Carrie, how do you address the issues related to bilingualism and choice of language with families that have children that need EI services?
You know, unfortunately, I still have families that are concerned about the potential negative effects that they've heard about bilingualism and raising their child. Definitely, I want to educate them on, first of all, what we know about bilingually developing children, that their development may not look like the typical development of a monolingual child, but that doesn't mean that it's a delayed language development. So I help them to look at certain milestones that they can see that their child is on track. This might mean looking at receptive language as opposed to expressive language, looking at their play skills or their social interactions. Also talking about things like vocabulary development. We know that if we look at only one language in vocabulary development, it might seem a little depressed compared to their monolingual peers. But when we really look at their vocabulary development in both languages, or what we would call conceptual vocabulary, we might see that it's right on track or even ahead of some of their monolingual peers. Other things I would ask for them to look at is to think about what they are receiving and then what they are able to offer us. So their input is going to equal their output. When I say this, I want them to think about where they spend their time and what kind of language they're receiving. And this is going to mirror what they're going to be able to see their child offering as language output. So for example, they're getting their parent-to-child interactions, child-to-child interactions. What kind of music do they listen to? What are they watching on the TV? What kind of literacy activities are they having? If they spend 90% of their time with one language and only 10% of their time with the other language, you might see that the other language is not developing quite like the one that's receiving 90%. But if you think about it as far as input and output, that completely makes sense. So the parent doesn't have to needlessly worry about that second language and it not developing as quickly. Finally, I would just give parents some of the many references that we have right now that tell us that yes, bilingualism doesn't have necessarily negative effects, but it actually could have positive effects for their children down the road. And there are so many great articles that offer strategies that can help them raise a bilingual child.
Carrie, what makes effective service with this population?
Well, the early intervention system, and I'm especially going to be speaking for in the state of Illinois, is definitely family-centered, and that's part of what makes it such an effective form of intervention for these younger children. When I say family-centered, we start everywhere from the goals that are made are really including the families when we're making the goals, the fact that the intervention is offered in the home setting, that the materials are the same materials that are used in the home, the same toys that the children use every day are the toys that we use, and then finally that the parents play such a vital role in the actual implementation of the therapy itself. When we look at this, what we want to say is, what does this child's typical day look like? And then how can the parent use these same activities that they do every day with the same toys that their children play with every day in order to help facilitate language and maybe areas that they haven't thought of doing before. What we don't want to do is add homework to parents who are already very busy and trying to raise their children. We want to make it as simple as possible.
Carrie, thank you very much for coming today. It's been really interesting talking to you about early intervention issues with bilingual children.
Oh, thank you. It was a pleasure to do it.